Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Leep. Introduction. Leep is a common procedure that is used to treat and test cell growth that is not normal on the cervix. Leep is short for loop-electrosurgical-excision-procedure. Thanks to a procedure called a Pap smear test, abnormal cell growth on the surface of the cervix can be easily detected. If your Pap smear test shows abnormal results, your doctor may recommend further tests and Leep. Leep lets your doctor take out the abnormal areas on the surface of your cervix. If your doctor recommends a Leep procedure, it is your decision whether to have the procedure or not. This patient education tutorial will help you better understand the Leep procedure, as well as its benefits and possible risks. Anatomy. The female reproductive organs include the vagina, uterus, fallopian tubes, ovaries. These organs are located in the pelvis between the urinary bladder and the rectum. The ovaries have two main functions. 1. The production of specialized hormones, such as estrogen and progesterone. 2. Ovulation, which is the release of eggs needed for reproduction. Estrogen and progesterone prepare the inner lining of the uterus in case a pregnancy takes place. These hormones also regulate when the eggs get released. When an egg is released, it goes down the fallopian tube, where it may or may not get fertilized by sperm. If it is not fertilized, the egg and the inner lining of the uterus are discharged to the outside of the body during the menstrual period. The uterus is pear-shaped and about 3 inches long. The lowest part of the uterus is called the cervix. It opens into the vagina. The vagina opens to the outside of the body between the urethra, which is the urinary bladder opening, and the rectum. Diseases of the cervix. Cells on the cervix grow and die all the time. Sometimes these cells can change and become abnormal. Abnormal cervical cells are also sometimes called cervical dysplasia. Some sexually transmitted diseases are associated with changes in the cells of the cervix, which can lead to cervical cancer. Since the cervix comes in contact with semen during unprotected heterosexual sex, it can become infected with sexually transmitted diseases. The Pap smear test helps your doctor detect abnormal cell growths early. It is named after the doctor who made it popular, Dr. Papanicolaou. During a Pap smear test, your doctor will swab the surface of your cervix and take a sample. The sample is sent to a lab to be tested. If abnormal cervical cells are found and left untreated, it could lead to cervical cancer. Abnormal cells can change gradually and become more abnormal if left untreated. Early changes and abnormalities in the cells of the cervix are called low-grade dysplasia or atypia. After a while, low-grade dysplasia could get worse and change to high-grade dysplasia. High-grade dysplasia that is located on the surface of the cervix is sometimes known as carcinoma in situ. If not treated, the high-grade dysplasia could change into cancer and spread deeper into the cervix. From there, it could spread to other parts of the body. Dysplasia can be treated successfully. Early detection and treatment can help prevent abnormal cells on the cervix from getting worse. Recent vaccines have been shown to prevent infection with some of the strains of the sexually transmitted human papillomavirus or HPV. This virus is the leading cause of cervical cancer. This is why these vaccines, Gardasil and Cervarix, are also seen as vaccines to prevent cervical cancer.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Leep. During a leap, some or all of the abnormal parts of the cervix are taken out. The Leep procedure is done under local anesthesia in a doctor's office and takes on average 15 to 20 minutes. You will be able to go home after the procedure is done. You will be asked to undress from the waist down. You will be given either a gown or sheet to drape over your lap. You will then be asked to lie on an examination table and put your feet in the stirrups. Next, the doctor or nurse will gently open the vagina and insert a speculum. A speculum is an instrument that keeps the vagina open so the doctor can see and reach inside the vagina more easily. Your cervix will be numbed with a local anesthetic, and the abnormal cells will be removed with a wire heated by an electric current. A leap is not painful, but may be uncomfortable. When the doctor is finished, the speculum will be taken out, and you'll be able to put your clothes back on afterwards. After a leap, the tissue taken out is sent to a lab to be tested. In many cases, Leep can effectively treat the abnormal cells. If the test results show more advanced abnormalities, you may need additional treatment. Risks and complications. The Leep procedure is very safe. Risks and complications are extremely rare. Knowing about them may help you detect them early in case they happen. Risks and complications related to any surgical procedure include bleeding and infection or scarring of the cervix. These are rare. Scarring may make it more difficult to interpret future pap smear tests. There is a very remote possibility that a leap may make it more difficult to become pregnant or cause problems with pregnancy. This is possible if a big part of the cervix is taken out during the leap procedure. After the procedure, you will be able to go home the same day after the procedure. The cervix needs time to heal, so you should not have sex and not place anything in the vagina for several weeks. After a leap, you may feel cramping and will have some bloody discharge. If the discharge becomes bright red, very heavy, or foul-smelling, you should call your doctor because these may be signs of internal bleeding or infection. You should not do heavy exercises for a few days after the procedure. Showers are okay, but whirlpools, prolonged tub baths, and saunas are not recommended. Your doctor will tell you when these are safe. Your doctor will also tell you when it is safe to have vaginal intercourse, use a tampon inside the vagina, and douche.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. The Leep procedure is a very safe procedure that can help doctors test and treat abnormal cells of the cervix and even prevent or cure cervical cancers. The Leep procedure is done under local anesthesia in a doctor's office and takes on average 15 to 20 minutes. You will be able to go home after the procedure is done. The risks and complications of the Leep procedure are extremely rare. Knowing about them may help you detect them early in case they happen.
Thank you for using Explain.